Hello, everyone. I'm Matt Danford, Managing Editor with OR Manager, and I'm thrilled to be here today with Dr. Dan Weberg, Executive Director of Nursing Workforce Development and Innovation at Kaiser Permanente. Dr. Weberg is set to deliver the opening keynote at this year's OR Manager Conference on October 28th in Anaheim, California. His talk will explore the current state of nursing amid healthcare disruption, using the idea of a blockbuster moment to highlight both risks and opportunities facing the profession. Let's jump right in. Dr. Weberg, as noted by the title of your session, you're calling this healthcare's blockbuster moment. Can you explain what you mean by that analogy, why you think perioperative nursing is particularly positioned at this crossroads?
Yeah. So remember in the 90s when we'd go to a Blockbuster video and figure out if the new release was out that minute and the smell of stale popcorn and sadness sort of lingered in the air. That's where nursing and healthcare is right now. And we all know where Blockbuster went. It was away. There's now one Blockbuster left in Bend, Oregon. And it's because Blockbuster Video doubled down on the past. They thought brick and mortar rental and late fees were the future of how people would consume video content. There were disruptors that were challenging that business model, like Netflix and Amazon and others. And Blockbuster continued to double down on we are the best. Our legacy process is the way to go. And healthcare is in a very similar spot right now. We have massive disenfranchisement with our healthcare workers. We have violence against nurses. We have cost overruns. We have all the policies and politics happening. And you can hear from our nurses and from our other healthcare workers that they're dissatisfied with the current conditions. And we are at a crossroads. Our blockbuster moment is we can double down on the past. And I hear it all the time. Let's go back to pre-COVID. Let's go back to the way it was in 2018. Or we have our chance to build our desired future and innovate our way to a healthcare system that we want to be a part of. And that's really the crux of the blockbuster moment.
Okay. So where can nursing specifically shift to be ready for this?
Yeah, so I think there's three big buckets of work that nursing needs to sort of focus on. The first one is in our workforce. So our workforce is changing. We have nurses who are not working at a health system for 30 years and retiring with a pension anymore. They want to work for a couple years. They want to move around, explore, go travel, come back, establish a family, come back to an organization, and then do that all over again. Or they're taking non-traditional jobs in which they're working for tech companies and other organizations that need nursing talent. And so I think we have a chance to innovate what the workforce of nursing looks like. The second place is really in education. And, this is near and dear to my heart in my role now. We hire about 1,000 new grad nurses every single year into our organization. And it still takes us a year to take them from graduating nursing school to being a safe, independent practitioner by themselves on a hospital unit or in an OR. And, if you bought an iPhone and you couldn't turn it on for a year, you'd stop buying iPhones. And so we really have an opportunity here to support shifts in nursing education to develop the skills and competencies so they hit the ground running. If we can change that year-long transition program to, let's say, 6 months, that's multiple millions of dollars in savings and a workforce that's getting into the pipeline faster and being productive rather than having these big lag times between academia and practice. And the third bucket is really technology. And we're being completely disrupted. Everything's AI now. But healthcare tends to be the last adopters of brand new technology. And so how does nursing lead the way to incorporate tools like AI, like wearable technology, like remote monitoring, and actually bring it to the forefront and support the growth and changes in our workflow moving forward?
So this idea of technology changing the workflow is really interesting and obviously super relevant. I wonder if you could cite a specific example or two of something going on right now of that.
Yeah, there's a couple that are out there. And so in 2009, there was a study done called the Time and Motion Study, and it really looked at where do nurses spend their time. And we found about 36% of nurses' time is spent hunting and gathering information, people, or supplies. About 50% of the time is in documentation and electronic medical records. So that's about 80% of a nurse's day is non-patient care related, right? It's like sort of administrative or hunting and gathering. And that's really where technology can come in and support nurses. So, reducing clicks in electronic medical record documentation. There's AI ambient listening now that has been really readily adopted by our physician colleagues to just record what's happening in the room and automatically create a note out of it. Now, if nurses could have that same technology for their workflows, imagine doing an hour-long, head to toe assessment on a new admission in a hospital unit, or coming out of surgery and doing your post-op assessment. You just speak your assessment and it automatically charts. That's hours a day of work taken off of a nurse that could be redeployed into patient care and dealing with the family and all the things that nurses are really good at, and supporting, and not just documentation. In other areas, it's wearable technology. Nurses are great at longitudinal data assessment and seeing patterns and trends in data. If we can incorporate wearable technology on our patients and see those trends in real time, nurses are positioned really well to make better decisions for their patients. And so there's a lot of technology out there that can take that administrative burden off of nurses and return them back to what they need to do, which is be at the bedside with patients and dealing with the complexity of that kind of care environment.
What do you say to the skeptics? So I'm sure there were similar arguments advanced with the advent of, say, platforms, patient portal platforms, but now caretakers complain about the amount of time they spend responding to messages to these, in these systems that were supposed to streamline. Just to name one example, I wonder what you would say to those skeptics, or maybe you have advice for, ensuring this technology works for the nurses and not against them.
Yeah, I actually have a great slide, and we'll be presenting it at the conference as well. And it's about AI and the bias that is sort of around that. And you can take this with a number of different platforms that are out there with technology. But there's complaints about specifically with AI, it's biased in decision making, right? You don't know where it's getting its references. The privacy issues, like what happens to my question, my prompts, who's using that data in the back end, or what does it know about me? Lack of transparency in how it reasons to get that information to you. And then there's the hallucinations. But my response back is, what's the alternative? The alternative for nurses is we go ask the most experienced in our mind person on that unit for the same information. If I don't know something, I go to Sarah or Jerry, who's been here a while, and I ask them. But they also are biased in their decision making. Maybe they've only worked for this company and they went through a certain education platform that I don't know about. They're definitely going to tell their friends in the break room. So they've broken privacy about how dumb my question was. They lack transparency. If I ask them for specific citations, they're probably not going to be able to give it to me. And we all know, because of the holiday party, that Jerry hallucinates too. So, we can't just throw out technology because we think it's not, valuable or it's not trustworthy. Our current process in getting clinical information or just-in-time information is just as flawed. So I think we have to really look at the workflow and be critical about where we're getting the information to make the decisions we need to make, but not just throw out the entire technology because we've heard, we think that it's biased. Our other solutions aren't any better.
Sure. Back to the idea of the blockbuster moment. Maybe if we could take a step back for some broader context. We've gotten into nursing specifically, and even now we've gone down the AI rabbit hole. But I wonder if you could speak more to the disruptions in healthcare as a whole.
Yeah. So, there's a lot of disruptions happening, right? So we have new entrants into the healthcare industry. We have Amazon, we have private equity, we have all these startup companies coming in, new insurance products that are entering healthcare that were never there before. It was always sort of these legacy systems, the big names, the big healthcare organizations. And now we have tech companies coming in saying, we're frustrated with the system, and we think we can take our history of innovation and disrupt the healthcare organization as a whole. And so that's, that happens. That's what the catalyst of innovation in every other industry in the world. We look at Uber and, Amazon and all these other industries, Facebook for media, all these different things came in. They were entrants that were new to the industry, and they completely disrupted it. So that's one area. We have new technology that's completely shifting workflows with the AI, the monitoring, mobile diagnostics. You don't have to go to a hospital to get all the services that you used to have to go to a hospital to get. Home health is the new medical surgical unit, and ambulatory surgery centers are doing complex cases and discharging people in 24 hours. There's amazing technology that's supporting it. And so integrating that into our workflow is causing disruptions because it's not the same old way we did things. We have new politics, which I'll, no comment on the politics piece, but there are new bills and new focus areas and things happening here. And we have new population behaviors as well. So coming out of the pandemic, people are consuming healthcare differently. They're questioning, they're bringing data to their doctor's offices and nurse practitioner visits. And they're interacting differently with the healthcare system. And finally, there's a shift in the perceived value. Nursing is now seen as a critical element to healthcare and to the operations of healthcare systems, and they're starting to be valued more. And so the growth of nursing and nursing roles is accelerating. So all of those pieces are kind of saying we're at a paradigm shifting moment where we're moving away from the old way we did things, even old being 2017, 2018, into a world that's going to be completely technology enabled, supported by new workflows and with new ideas coming from people that were never in healthcare before. So that's really crafting our blockbuster moment.
And so we're all queued up. And on that note, one of the things that really intrigued me in the abstract your presentation was this idea of not so much adapting to the future, but building it. And kind of as you're saying, we're nurses are queued up to do that. I wonder if you could have any words of advice for leaders, particularly in the perioperative space, for how they can begin doing that, how they can lead the charge rather than just respond to the changes that they see.
Yeah, and that's the crux of the keynote when we have the conversation in October. There's really three big rules. The first one is you don't need to be an innovator to lead innovation. So take that assumption out of your head. You don't have to love technology. You don't even have to have a smartphone, but you have to know that leading change requires the building of a safe environment and a psychologically safe environment. So the disruptors, the people who love to change and challenge the status quo, can thrive and feel safe in doing so. The second rule is you have to treat innovation as a process. It's just like an admission assessment or an OR case. Like it has a start and an end, and you need to follow the entire process. So these post-it note parties and things that we'll talk about in the keynote aren't always innovation. That you have to really plan from understanding the problem all the way through testing and iterating and deploying, and understanding that process as a leader is really important. So which tool to deploy at which point in the innovation process to allow for novelty to occur. And the last one, which is my favorite, which is leaders are deviation amplifiers. And so you need to know that an organization is set up in routines that happen every single day. And the role of the leader in creating change is to disrupt those norms, those routines that happen every single day, and create little deviations that lead to new ways of work. And if you can embody those three rules, then you're going to lead innovation, your organization's going to thrive, and your nurses are going to want to bring you ideas to improve the organization even more.
Well, thank you so much, Dr. Weberg, for joining us today. Thank all of you. And I'd like to remind everyone to join us in Anaheim, California, October 28th to 30th to see this presentation and many others in person at the OR Manager Conference. Just visit ormanagerconference.com to register. Thanks again, and have a great day, everybody.